Community Health Worker Training, Cardiovascular Health and Diabetes. Mini Module 9A, Patient-Driven Healthcare. Learning outcomes for this mini module. List 9 lifestyle categories that are important to good health. Explain the patient's role and responsibility as a member of their healthcare team. And describe ways a community health worker can support healthy lifestyle choices. Lifestyle choices that are important to good health. We sometimes think about our health in terms of how good the health care is that we get, but that's actually only a small portion of how healthy we are. A lot of other factors go into how healthy each of us is, and some of those factors we have some control over. So these are 9 lifestyle choices that people do have control over that are important to good health. So choices that people make about their diet and the effect that diet has on, among other things, their weight and their body mass index, their BMI. Choices about exercise. So how much physical activity does somebody do and what type of physical activity? There's sleep. Getting enough sleep is very important to both mental health and physical health. It also helps people to maintain a healthier diet. Avoiding substance abuse. And in terms of substance abuse, we're not only talking about drugs and alcohol, but also tobacco. Avoiding medication abuse. The application of modern technology. So what we mean here is really, is somebody on a computer in front of a screen all day, or are they getting up and moving around? Are they using technology to help keep them healthier, right? So tracking their physical activity, tracking their labs, their blood pressure, whatever. Or are they, kind of on the computer 24/7 and really not moving around and not making healthy choices? Recreation. Again, are you making healthy choices around recreation? Ideally, things that are both safe and physically good for you. Choices around mental health. So a certain amount of mental health is not under our control. If you have a mental illness, that may be something that you inherited in the same way that you inherit other illnesses. But there are some important things that we can do to try to maintain a healthier mental health, including mindfulness things, stress reduction activities, getting help when we need it. For instance, if you start to feel depressed. So good hygiene around mental health. And then choices around sexual behavior. Are we making good choices? If you have more than one partner, are you using condoms? What kinds of sexual choices are people making? So the role of a patient in our healthcare system has really changed. In the old days, the doctor told the patient what to do, and the patient was expected to do it. This is actually still the healthcare model in some cultures, and you need to be aware when you're working with your clients that we may be saying to them, we want you to be a partner in your healthcare, and they may have no idea what we're talking about, or they may be uncomfortable with that because that may not be what they expect from the culture that they come from. In the past several decades, the U.S. healthcare system has moved toward a more shared decision-making model, with patients expected to take a much more active role in their own healthcare. Now healthcare providers are expected to explain health conditions to patients in more detail and to describe the various treatment options, including the risks and benefits of each. The patient is then expected to help make decisions about which treatments they want. They're also expected to take a more active role in keeping themselves healthy, not simply in seeking healthcare when they're sick, right? And that's what we talked about in the preceding slide about lifestyle choices that people can make to try to keep themselves healthy and promote health. So this new role of sort of co-managing your own health requires patients to get information about their health and to feel empowered to make health decisions for their own lives. They also need to feel empowered to ask questions so that they have the information they need to make those decisions. So if you look at this picture, the traditional healthcare model is really a top-down kind of a model, right? So you've got a patient with a chronic disease in this case. The primary care provider essentially tells them what to do and then may send them for additional services or to see specialists if that healthcare provider feels they need it. Nowadays, we're more in the model on the right, which is that the patient, right, they talk to their healthcare provider, but they also get services in terms of social support. They get help in terms of self-monitoring, monitoring at home, feedback from their healthcare team about how they're doing. They may see a diabetes educator. They may see a dietitian. They may get involved in a physical activity program. And then both their PCP and the patient gets feedback about whether or not that's helping their health condition so that they can adjust and make informed decisions about how to proceed. So in that new model, the patient is really a co-manager or a partner in making healthcare decisions. And that's as it should be because it's their body and it's their life. The reason this is so important and the reason patient-driven healthcare is so important is that patients are the experts in their own lives. They know what their priorities are, including priorities around taking care of themselves and around their health. They also know what's possible for them or what they can handle right now. For instance, a busy single mother who's employed full-time might know she should exercise 5 days a week, but the reality of her life makes that nearly impossible, no matter how many lectures she gets from healthcare providers about how important that is. That's why patient-driven healthcare is important. It asks patients to help design their own care, taking into account the realities of their lives right now and their priorities. What health promotion activities are most important to the patient and which ones can they focus on at this time? What other services or information do they need to be able to do it effectively? For instance, if the single mom we were just talking about is a diabetic who acknowledges the need to see an eye doctor, does she need help with transportation or with an interpreter? If she's ready to make changes in her diet, does she know how to cook healthy food? Can she afford it? And can she access it in her neighborhood? If not, what can the healthcare team, including community health workers, do to support her to make these healthy changes? Only by listening to the patient and asking questions can community health workers help to support patient-driven care. And this type of care is more likely to actually work, right, than simply telling the patient you must do X, Y, and Z, when maybe they really can't do all those things in their lives right now. So this slide shows you in terms of what goes into your healthcare. It's estimated that about 40% of your health is about socioeconomic factors or factors that we call the social determinants of health. And that may include things like where you live and how healthy your neighborhood is, whether you can access healthy food. That's included in the 10% of your physical environment as well. What type of job do you have? Is it a safe setting? What kind of family and social support do you have? Then we estimate that about 30% of somebody's health has to do with the health behaviors that we already talked about. So tobacco use, diet, physical activity, alcohol use, sexual activity, and other kinds of behavioral choices that they make. And only about 20% of how healthy you are is actually health care itself. Community health workers have an opportunity to influence clients around both healthcare, right, around following advice, but also around some of those other characteristics or those other aspects that go into helping somebody to stay healthy. Here's a short video talking a little bit more about what patient-centered care is and how to take an active role in your own health care. And as you're watching this, think about the fact that community health workers are uniquely positioned to take the lead in healthcare or social service settings to advocate for patient involvement in their own care. And again, while you're watching this video, think about a time when you've done this with a client. What worked well? What could you do differently next time? So go ahead and click on this video.
What is patient-centered healthcare and why is it important? When it comes to healthcare in this country, we do something very well. We spend more and we get less. Each year, we spend almost $3 trillion on healthcare, yet we have skyrocketing rates of chronic diseases. Our health and our healthcare system are in crisis. Part of the reason is that the sickest 5% of our population uses over 50% of our resources. That's just not sustainable, and something has to change. One solution that can help is patient-centered healthcare. Patient-centered care focuses on wellness, not on sickness. What would that look like? With our patient Malia, it means we do more than just see her when she wasn't feeling well. It means we'd encourage and even help her get more physically active. We'd recognize that good health care includes the body and the mind, integrating primary and behavioral health. Finally, our dietitian would teach Malia to prepare meals that could help control her diabetes. By also involving her family, we'd strengthen her support system and make it easier for her to stay well. Patient-centered care takes a team of doctors, nurses, and other providers, all working together with you and your family to keep you healthy. Patient-centered care accomplishes three major things. First, by being comprehensive and proactive, it improves your health and keeps you well. By keeping you well, it also controls healthcare costs. Finally, your experience as a patient is more satisfying and you live a longer, healthier life. Patient-centered care will transform our disease care system into one that focuses on health. And it's been shown to work all over the country, improving quality and saving hundreds of millions in healthcare costs. This kind of healthcare is being called by a lot of different names. As a patient, this can be confusing, but it shouldn't be. Because patient-centered care isn't a name or a checklist. It's a partnership between you and your healthcare team. As the patient, you have the most important role in improving and maintaining your health. And that's why community health centers are so vital. Because we believe in providing proactive, comprehensive, patient-centered care, in focusing on quality and innovation, and in partnering with specialists, hospitals, and other organizations to improve your health. From providing essential care to communities in need, to treating the whole person all in one place, community health centers are doing what's right for everyone.
So how can community health workers help community members make healthy lifestyle choices? There's a lot of things you can do. These are just some of them. You can teach community members about the importance of healthy lifestyle choices. You can teach them about the link between healthy lifestyle choices, heart disease, and stroke, and other health conditions, diabetes. You can help community members identify resources such as around their diet, local grocery stores with affordable healthy food, SNAP or WIC benefits, food pantries, healthy cooking classes. Around physical activity, you can help them identify safe outdoor spaces, community sports leagues or dance programs, affordable gyms, pools, or exercise classes. And you can also help them to identify resources around substance abuse and smoking cessation programs if those are services that they need. Now you can list 9 lifestyle categories that are important to good health, explain the patient's role and responsibility as a member of their healthcare team, and describe ways a community health worker can support healthy lifestyle choices. The next module, 9B, is getting the most out of doctor's visits.